The FDA authorized a second booster dose for Pfizer and Moderna's COVID-19 vaccines for people 50 and older. But a lack of federal funding could slow the rollout across the country, and some health experts also question whether a fourth vaccine dose is needed. Meg Oliver has more.
In a rare move, the FDA did not consult with its Vaccine Advisory Committee before authorizing a second booster from Pfizer and Moderna for people 50 and over. Dr. Celine Gounder is an infectious disease specialist.
I am very skeptical that giving everybody over the age of 50 a fourth dose will have a real impact in the long term on reducing severe disease, hospitalization, and death.
The FDA has also authorized the optional second booster shot for individuals 12 and over who are immunocompromised. UPenn immunologist John Wary supports the idea for that group.
We're seeing more waning of that ability to stay out of the hospital should you get infected. And for the immunocompromised, clearly there's benefit of a fourth dose.
This all comes as vaccination rates are lagging. Only half of people over 50 are boosted. This super site in Westchester, New York, is closing on Friday due to lack of demand for shots and testing. Federal funding is also running out. The Biden administration has already stopped accepting claims for testing and treatment, and starting next week will no longer support reimbursements for vaccinations.
This really does beg the question, where should we focus our limited resources? Is it on providing fourth doses, or is it on other measures, for example, making sure we vaccinate people who may not have even had a single dose yet?
For people 50 and over, boosters are now available at sites like this one if you had your first booster at least 4 months ago. Next week, the FDA will meet to possibly discuss authorizing boosters for a larger population in the fall. Lana?
Meg, thank you so much. For more now, I want to bring in Dr. Celine Gounder. She is an infectious disease specialist and epidemiologist at NYU's Grossman School of Medicine and Bellevue Hospital. She's also the host of the Epidemic podcast. Dr. Gounder, welcome. So remind us, how long does protection last after getting a shot?
I think what we need to ask is, how long does protection last against what? So are we talking about protection against infection? Are we talking about protection against severe disease, hospitalization, and death? And we know that protection against infection does wane more quickly, probably on the order of 3 to 4 months, that you get protection from a booster dose of vaccine, or for that matter, from a breakthrough infection. But what's really important to emphasize is that the protection against severe disease, hospitalization, and death, which is, after all, why we vaccinate against COVID and other diseases, that protection is much more long-lived.
And do we have a sense of how long that actually lasts, or is that something that doctors like you are still figuring out?
Well, we're still studying. We only have data out really for just over a year, because that's how long we've had these vaccines for. So that's as much as we can say, is that even a year after vaccination, protection against severe disease, hospitalization, and death remains quite good. And so I think we have to now ask, what is going to be the goal of our vaccination program? And the FDA is convening a meeting on April 6th to discuss this in more detail. What are the goals, and how do we get there?
And Dr. Gounder, you say that we need to come up with a plan that does not require people to get boosted every 3 to 4 months. It sounds like it goes to what your point about what's the goal of vaccinations. What would you like to see happen?
Well, I think we need to be looking at other measures that do not require individuals to take action. I think anything that requires an individual to seek it out, to overcome barriers, to comply, whether that's masking or vaccination, is going to have its limitations. You're not going to have the same public health impact unless everybody jumps on board and takes up these interventions. So what are the other things we can be doing that are more passive, that don't require people to take action? Those would include interventions like improving our indoor ventilation and air filtration. Once you make those upgrades, you maintain the systems, the people in those buildings really don't have to give any thought to it. They are protected. And so these are measures that can have a real impact at a population level in a sustainable way, that won't require somebody taking action every 3 or 4 months to get a booster, for example.
and potentially also has other benefits beyond just COVID-19. But Dr. Gounder, as we're running out of COVID funding here in the U.S., is that going to complicate progress made against the pandemic? And who do you think should be paying for these additional booster doses?
So as of right now, we do not have enough doses to cover everyone over the age of 50, or even for that matter, everyone over the age of 65 who wants a fourth dose or a second booster dose. So that will require purchasing additional doses. There has been a stalemate in Congress over whether and how much to give additional funding for COVID efforts. And as was noted earlier, we have run out of money to cover the cost of administering vaccination, as well as testing and treatment. If you are uninsured, the money to cover that is gone. And so this is going to be a huge limitation. It doesn't matter if we advise or recommend people get additional boosters if the vaccine doses are not there and there aren't people who will be paid to provide them.
I'm curious how concerned you are about the new Omicron subvariant BA2, because nearly 55%, according to the CDC, of all new COVID infections are from that subvariant. Cases we know are also rising in Asia and Europe. What can the U.S. expect in months ahead?
It's a little hard to say. What we can see from the Asian and European experiences, it certainly can result in a surge, even in populations that have been vaccinated, that have had prior infection. However, there are some important differences. So the elderly in East Asia, including China, Hong Kong, are much less vaccinated. And they're also using the Chinese vaccines, which are less effective. As for Europe, I do think we need to look very carefully at their experience. They're probably, especially the UK experience, is probably a better predictor of what is yet to come. I think in parts of the country that are highly vaccinated, that have relatively younger, healthier populations, you'll see less of an impact. But in populations that are older and not very vaccinated, we could see a surge in hospitalizations and deaths again.
All right. Dr. Celine Gounder, thank you for joining me, and thank you for all that you do.